COVID-19 awareness training. Here we will discuss the expectations, procedures, and how to prevent the spread. Our training topics will include what is COVID-19, the COVID-19 transmission routes, prevention measures including social distancing and physical separation, facial coverings, proper hand washing, disinfection of common surfaces, and then we will discuss the returning to work procedures. Is COVID-19, also known as Severe Acute Respiratory Syndrome or SARS-CoV-2, formerly known as 2019 nCoV, is a respiratory illness caused by a novel coronavirus originating out of Wuhan, China in December 2019. The World Health Organization declared a global pandemic on March 11th of 2020. There is community spread in many countries, with the total coming to 216 countries, areas, or territories, according to the World Health Organization as of May 27th, 2020. First, let's discuss how is disease transmitted. There are necessary conditions, including the presence of pathogens or germs, a sufficient number to cause infection, the ability to cause disease, a way to get into the host, and the host must be susceptible to the infection. All of the necessary conditions listed have to occur for you to become sick with an infectious disease. We will always assume that germs are present, even when they may not be. Fortunately, when these organisms are outside of the body, they start to die off, and the ones that are able to survive may be too damaged to make us sick. We cannot count on all of that to be true all of the time, though, so we have to block them from getting to us in the first place. If they should happen to slip by, our immune system will try to defend us. Different routes of entry to enter your body. The first one is inhalation, which is entry through the respiratory tract or lungs. The second is using mucous membranes, which are the linings of openings in the body, including your eyes, nose, and mouth. Different pathogens will use different routes of entry. Pathogens of the respiratory system would prefer to be inhaled, but mucous membranes of the nose and mouth may also be used as routes of entry. COVID-19 mode of transmission. There are 3 different types of transmission routes. The first one is direct contact, or person-to-person. Contact with an infected individual or an exchange of bodily fluids with an infected person. The fluids in the case of COVID-19 pathogens are expelled from the respiratory system of the infected person. They can be released by coughing and sneezing. The second mode is aerosol transmission, which occurs when someone has coughed or sneezed, releasing pathogens into the air. They can be suspended in the air for various amounts of time based on their size and can be carried by air currents into other areas of a room or connected spaces where they can be inhaled by you. The COVID-19 does not appear to need the force of a cough or sneeze to be propelled into the air. Breathing and talking normally have been suggested as ways for this germ to be released close to where the infected person is standing or sitting. The last mode is indirect transmission, which occurs when you touch objects and surfaces contaminated with pathogens, then touch your face near mucous membranes. The sharing of phones, tablets, workstations, tools, and other items can easily transmit pathogens from an uninfected person to you, without you ever touching that person. Contamination will not be visible on these objects, and the pathogens will have different survival times in the environment. COVID-19 symptoms. Common symptoms can include a dry cough, shortness of breath or difficulty breathing, and fever. Less common symptoms include chills, muscle pain, sore throat, new loss of taste or smell, and nausea, vomiting, or diarrhea. Symptoms of COVID-19 may appear in as few as 2 days or up to 14 days after exposure to an infected individual or surface. Anyone can have mild to severe symptoms. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from the COVID-19 illness. When to seek emergency medical attention. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. They have trouble breathing, persistent pain or pressure in the chest, new confusion, the inability to wake or stay awake, and bluish lips or face. This list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for yourself or someone else who may have COVID-19. There are several COVID-19 testing locations in Lubbock. There is one at the Patterson Library location at 1836 Parkway Drive. At UMC, call 806-761-0111 for pre-screening prior to arrival. There is also one through Covenant Health in Wolfforth at the Friendship Football parking lot. Call 806-725-TEST for pre-screening prior to arrival. There are additional resources available on both the UMC and Covenant Health COVID-19 pages. Now we will talk about the prevention measures that we can all take to help prevent the spread of COVID-19. The first topic of discussion is social distancing and separation. Keeping the space. Social distancing is the practice of maintaining 6 feet, or roughly 2 meters, of distance between people. Social separation is using staggered shifts to reduce the population of a work area during any given time period, or having people conduct work in separate work areas. Achieving social distancing and reducing exposure. There are many different ways that we can work together to help to prevent the spread of COVID-19. We can establish separate workstations 6 to 10 feet apart. Ideally, you want to have 144 square feet per person. Avoid workstations that face one another. For example, do not use both sides of a laboratory bench. Move shared equipment to an easily accessible location by all parties. Reduce the exchange of materials, if possible, and make walkways one-directional if possible. Work to establish a separate entrance and a separate exit for the work area. This means one door for people to enter the work area and a separate door for people to exit the work area. This can be done in collaboration with the Texas Tech Fire Marshal's office and ADA office. Use tape or other markers to designate 6 feet from desk areas, particularly in reception areas where they may be receiving guests. Install plexiglass walls if needed, and avoid gatherings larger than 10 people. Avoid smaller gatherings if social distancing principles cannot be maintained. The next type of prevention measure we will discuss are facial coverings. The CDC recommends whenever you are in public to wear a cloth face covering over your nose and mouth. First, let us discuss when to wear a face mask at Texas Tech. Your different colleges, departments, divisions, and research units will determine the areas where employees must wear protective face coverings when on campus. Example of these areas will include research laboratories and high traffic areas that involve interaction with the public, employees, and students. For example, reception areas and service kiosks. Once it has been determined that PPE for your area is required, you may reach out to the TTU Central Warehouse to coordinate the purchase of these needed items. In an effort to maintain costs, centralized bulk purchasing is being coordinated through the Office of Procurement Services and the Operations Division. The Central Warehouse may be reached at central.warehouse@ttu.edu. Employees who are not housed in high traffic areas are encouraged to wear protective face coverings when they are in high traffic or common areas. Examples of non-high traffic areas include individual offices or work areas with adequate space to maintain social distancing. Examples of common areas include public restrooms, break rooms, workrooms, and lobbies. Employees in non-high traffic areas will be responsible for obtaining their own personal face coverings prior to arrival on Texas Tech campus or other TTU facilities. Now we will watch a video on how to properly use, care for, and store a face mask. Hi everyone, Heather Coates with Environmental Health and Safety, here to talk to you about face masks, use, wear, and how to store them appropriately. So as we return back to campus, it's being recommended that you wear a facial covering or face mask as you return. It is not a requirement. However, your department may have a different policy or your section. Research laboratories where there will be more than one person working at any given time are going to be required to wear facial coverings. So keep in mind that your typical facial coverings such as cloth masks or surgical masks are there to protect the other people that you're around. So COVID-19 is spread by respiratory droplets. If we can reduce the respiratory droplets that come from me, for example, and then it decreases the risk of somebody else getting sick inside of that work area. So one I wanted to point out, this type of mask, this is known as an N95 respirator. These are the masks that are typically being used by our medical professionals, and these actually do have a filter inside of them. So notice they have two straps. If you have something that looks similar to this, but it has one strap, that is referred to as a dust mask. So you typically won't be wearing an N95. Some people on campus who work in certain areas or with certain materials may be wearing an N95 already for their work duties. However, we're going to talk about cloth masks and surgical masks. So this is just a typical surgical mask. So you'll notice one side of it has a metal, a malleable metal bar to it. So you want to put your mask on from your chin up, loop it around your ears, and then adjust it to where it fits securely around your nose and your mouth. You also want to make sure that you fit that top malleable metal piece to appropriately fit over your nose to create a nice seal along the top of your mask. So when you're wearing a mask, for example, if you're working in a laboratory space and wearing a mask, you're going to be handling chemicals or biological materials with your gloved hands. Don't touch your mask. Don't touch your face. Don't touch your eyes, your nose, your ears, anything that could potentially contaminate your mask. To remove a mask of surgical style, remove it by the ear loops. So we're going to talk about storing it as well. So you can remove that mask into a Tupperware container and then seal it up for later use. So you want to consider, after you've worn a mask, you want to consider the front of your mask contaminated. So you don't want to directly touch the front of your mask because that's where your respiratory droplets are going to be collected. There's also masks that have ties, and these are great because you can adjust how tight they are on your face to make sure you have an appropriate seal. So when you apply one of these masks, you want to make sure that you tie the bottom first at the nape of your neck using a bow. And then you want to bring it up, fold it out. Some of them will have a metal piece in there. Make sure you fold that to your nose. And then bring those other two straps around the very back of your head and make another bow. See? There we go. So I've got a nice tight seal here. So removing these, you want to remove the bottom one first and then untie the top. And then you can do the same procedure on taking it off into a Tupperware container to use it for next time. Okay. The last one I want to talk about is a cloth mask with the elastic loops. So this one does not have a metal band in it, but so I'm going to put it on chin first, bring it up over my nose. But you see how loosely fitting this is? So this is not really appropriate coverage. So I'm going to show you a couple tricks. If you have a carabiner, a small one or a large one, you can hook it on one of your ear loops and then bring it around and clasp it together behind your head. If you don't have a carabiner, I have two large paper clips clipped together because that's how tight I need my mask to be whenever I put it on. So you're going to stick the paper clips on one of your ear loops so you can put your mask on, put it over your face, and we're going to put our second ear loop through the paper clip as well. And then I'm going to go back and I'm going to adjust to make sure that I'm comfortable. So you see how much tighter this is fitting? I have a nice seal here along my jawline. Can bring it down a little more so it's not into the bottom of my eyelids. And I would keep adjusting a little bit along my ears to make sure they're a little more comfortable than what they are right now, especially if I'm going to be wearing this long term. And then you remove the same way by the ear loops into a container for storage. So cleaning your masks, surgical masks are not very easy to clean. So as they become contaminated, you want to replace it with a new one. Your cloth masks, however, you can launder them inside of a delicates bag if you have one. If you don't, I recommend that you hand wash with soap and warm water and then just let it dry on its own. If you have a mask of your own that you've been wearing out in public per the CDC recommendations already, feel free to use that one as you return to work. If you wear glasses, there are two methods you can use to prevent or reduce the fogging of your lenses while wearing a face mask. You can apply a thin layer of liquid dish soap or a layer of shaving cream and then rinse it off using warm water and dry your glasses gently. Discussed how to use a face mask and when to wear it as we return to work, let's discuss why facial coverings work. There have been many studies conducted over the past few months on the effectiveness on wearing a face mask. There are three main points that continue to arise. First is that asymptomatic, including pre-symptomatic infected individuals, are infectious. Second, respiratory droplets from infected individuals are a major mode of transmission of COVID-19. And last, face masks reduce the droplet dispersal. We'll now watch a simulation published in New York Times demonstrating this fact. 3D simulation shows why social distancing is so important. Public health experts and elected officials have emphasized again and again that social distancing is the best tool we have to slow the coronavirus outbreak. The Center for Disease Control and Prevention encourages people to stay home. If you must venture out, you should stay at least 6 feet away from others. The World Health Organization recommends a minimum of 3 feet of separation. Scientists are learning about the novel coronavirus in real time, and those who study similar respiratory illnesses say that until it is better understood, no guideline is likely to offer perfect safety. Instead, understanding the possible transmission routes for the virus can help us see why keeping our distance is so important. Scientists who study the transmission of respiratory illnesses like influenza say that infections typically happen when a healthy person comes into contact with respiratory droplets from an infected person's cough, sneeze, or breath. This simulation, created using research data from the Kyoto Institute of Technology, offers one view of what can happen when someone coughs indoors. A cough produces respiratory droplets of varying sizes. Larger droplets fall to the floor or break up into smaller droplets. The heaviest coughs release about a quarter teaspoon of fluid, with droplets quickly dispersing throughout the room. The simulation shows their spread over 1 minute inside a room of about 600 square feet. Under other conditions, the particles could behave differently. The CDC says keeping at least 6 feet away from others can help you avoid contact with these respiratory droplets and lower the risk of infection. That guidance is based on the assumption that transmission mainly occurs through large droplets that fall in close proximity. But as this simulation suggests, and scientists have argued, droplets can travel further than 6 feet, and small droplets known as aerosols can remain suspended or travel through the air before they eventually settle on surfaces. This is how they could disperse over the next 20 minutes. It's not like, oh, it's 6 feet and they've all fallen and there's nothing, said Donald K. Milton, an infection aerosol scientist at the University of Maryland School of Public Health. It's more like a continuum. In fact, researchers at MIT studying coughs and sneezes observed particles from a cough traveling as far as 16 feet and those from a sneeze traveling as far as 26 feet. All of this suggests that keeping a distance of 6 feet or more can greatly reduce the possibility of transmission compared with being closer. The farther away you get, the more diluted it is, Dr. Milton said of the aerosol. Coughing and sneezing may not be the only causes for concern. Studies of influenza have shown that infected people with mild or no symptoms may also generate infectious droplets through speaking and breathing. An infected person talking for 5 minutes in a poorly ventilated space can produce as many viral droplets as one infectious cough. If there are 10 people in there, it's going to build up, says Pratim Biswas, an aerosols expert at Washington University in St. Louis. In recent days, public health officials have suggested that in addition to social distancing, more people should wear face masks to help slow the spread of the virus. A mask disrupts the trajectory of a cough, sneeze, or breath and captures some respiratory droplets before they can spew out. A mask can also prevent large infectious droplets from landing on the nose and mouth, even though it provides minimal protection against inhaling the smaller droplets. Wearing a mask can help protect others and yourself. So, if you do need to leave home, wear a mask and be sure to keep your distance. The next set of prevention measures to be discussed include improved health hygiene practices. Health hygiene practices including not touching your eyes, nose, and mouth, your mucous membranes to prevent potential infection, staying home when you are sick except to get medical care, and covering your cough or sneeze with a tissue, then throwing the tissue in the trash and washing your hands. Some of you, as we return to campus, will be wearing personal protective equipment, or PPE, that you may or may not be used to wearing. So, we're going to discuss the proper order to put on and take off your PPE. Donning, which is to put on your PPE, has very specific steps. First, put on your body protection. This can be a lab coat, gown, or apron. Next, put on your face mask. Third, put on your eye protection. This can be safety glasses or splash goggles. If you are also wearing a face shield, Make sure you don your safety glasses or goggles first and then secure your face shield. Lastly, you will put on your hand protection, most commonly in the form of gloves. Whenever you are complete with your work and ready to take off or doff your PPE, you essentially do this in a reverse order. First, you will remove your hand protection or your gloves, which are most likely to be the most contaminated PPE on your person. Next, remove your eye protection using the earpieces. Make sure to not touch the front of your safety glasses or face shield because they should be considered contaminated. Next, you want to remove your body protection and either discard it or store it for later use. Lastly, you will remove your face mask and either discard it or store it for later use. Now that we discussed the correct way to don and doff PPE, let's talk about proper glove removal. Whenever you don gloves, which means put on, you should make sure that you don't touch your face, your mouth, any of your personal items that you would touch with ungloved hands, such as your cell phone, your purse, something like that. So I have my gloves on. I'm going to use some paint here to mock some contamination on my gloves. So I have contaminated gloves, and how do I take them off without touching my skin and then thus contaminating my person? So you want to pinch the palm of one of your gloves. You never want to go from the very bottom because then you'll touch your skin, and pull off that first glove. You want to make sure you pull it off slowly, otherwise you're going to aerosolize whatever contaminants happen to be on your glove at that time. So you ball that glove up in your still gloved hand. So I call this clean hand, dirty hand. Take your clean hand, and this one can go underneath the cuff of your glove. And then you want to pull that one off inside out as well. So then you want to make sure that you dispose of your gloves into a trash receptacle. While not everyone returning to campus will be wearing personal protective equipment, everyone will be washing their hands. Let's watch a demonstration on how to effectively wash your hands. I'm here to provide a demonstration on how to properly wash your hands or use a hand sanitizer. You want to make sure that you use warm water and soap and wash your hands for at least 20 seconds. But how do you actually do that to make sure that you wash your hands appropriately? So I'm going to use some paint in this demonstration to serve as my soap. So the first thing you do, wet your hands, get your soap, rub your palms together to create a nice lather of your soap suds. So now you can see that my palms are covered with soap, but I have a lot of spaces on my hands that have not had contact with my soap yet. So you make sure you get in between your fingers, and that includes doing the backs of your hands, of each hand, in between your fingers with the opposite palm. You want to grasp your hands, your fingers together like this to make sure you get your fingers, and you're going to do that in both hands. Let's see, I still have some blank. Rotational rubbing of your thumbs with the opposite palm. We'll make sure that you get all around that thumb and the other one. You want to make sure you do your fingertips as well. Your cuticles, your wrist, and your thumbs tend to be places where contamination is held. So making sure you pay special attention to those areas. And then you want to make sure you do rotational rubbing of your wrist with the opposite hand. So now you see my gloves are all coated in black, or my hands. So this is soap contact with my hands. And whenever you rinse, you want to make sure you rinse fingertips to your wrist, because that's going to wash any bacteria or dirt, the contaminants you're removing from your hands, from your fingertips, which are the most likely going to be contacting whatever it is you happen to be touching next. So you're going to use this same method with hand sanitizer. And thank you for watching. Stay safe. The last set of prevention measures that we will discuss are disinfectants and disinfection practices. It is all our responsibility. Custodial services on campus will do regular cleaning and disinfection of commonly touched surfaces once daily. You should implement a plan in your work area to frequently disinfect commonly touched surfaces. Shared equipment should be disinfected before and after each use by the individual user. Now let's watch a video that discusses different types of disinfectants and how to appropriately disinfect surfaces. Here today to talk to you about disinfectants and disinfecting. So there's many different types of disinfectants. I have a few here modeled, but disinfectants can be bactericidal, sporicidal, virucidal, and so they kill different types of harmful organisms, bacteria, virus, spores, mold, etc. So it's important to know what type of disinfectant you need to be using. There are several different types of common disinfectants that are used. We'll also provide a table of common disinfectants that gives you information such as the usable concentration, shelf life, and any of the hazards posed by these different disinfectants. Ones include sodium hypochlorite, which is your typical bleach, phenols, quaternary ammonium compounds, which are typically in your disinfectant sprays such as Lysol. Hydrogen peroxide is a very common and cheap disinfectant. And then your alcohol base, such as isopropanol or ethanol, are very common disinfectants. Each of them have pros and cons. For example, alcohols are flammable. Your hyperchlorates are very corrosive. So you want to make sure that you choose an appropriate disinfectant for whatever you happen to be disinfecting so you don't end up damaging the materials that we're trying to keep clean. So we're going to talk about common disinfection after you've used a piece of equipment or before you use a piece of equipment, leaving your workspaces, things like that. So first of all, I want to mention that chemical disinfectants are only for use on inanimate objects. Don't apply chemical disinfectants to your skin. Either wash your hands or use an alcohol-based hand sanitizer to wash your hands. Don't mix chemical disinfectants. They're not meant to be mixed. Harmful reactions can occur should the wrong types of disinfectants be mixed together. You want to make sure that you properly use, store, and dispose of any sort of chemical disinfectants that you're using. All chemical disinfectants have a large slew of precautionary statements, directions for use, etc. on their bottles per the hazard communication standard. So make sure that you review that information prior to using any sort of disinfectant. So let's talk basic steps to disinfection. First, you want to clear away any sort of debris or organic material first. Then you want to make sure that you prepare your disinfectant if it's something that needs to be prepared. So here I have hydrogen peroxide, isopropyl alcohol. These are things that don't need to be prepared ahead of time. Depending on your concentration of isopropyl alcohol, it's most effective at a 70% solution. So you can take your concentration, dilute it with some water, and then you can achieve the appropriate concentration for use. So these are essentially shelf stable. Your disinfectant wipes are also shelf stable. Your disinfectant sprays of different types are shelf stable. The one disinfectant that I want to mention that is not able to be used straight out of a bottle typically is a bleach solution. You have to dilute your bleach. We recommend a 2% solution because bleach is very corrosive. So you want to make sure that you're not corroding any of the surfaces that you're actually trying to disinfect or decontaminate. Usually if you mix your disinfectant in a spray bottle, make sure that you label it appropriately. So sometimes you're going to wear gloves, sometimes you're not if you're going to be using a disinfectant. I typically recommend wearing gloves if you do have them available, just so you don't have any of that chemical residue left on your hands. If you're working somewhere in like a laboratory space, you're already going to be wearing gloves before you decontaminate your surfaces. So basic steps. Step one, we're going to talk about removing any debris. So that could be, salt crystals, dirt, anything like that that's left on your work surface. Prepare your disinfectant. And then step three, you want to apply disinfectant. See how well you can see this. And you want to apply enough disinfectant for that surface to stay wet for the appropriate contact time. Contact time is the amount of time that a disinfectant needs to be in contact with the surface to appropriately decontaminate or disinfect that surface. So every one of these disinfectants here will have a different contact time. Read your manufacturer labels to identify the appropriate contact time, and make sure that whatever surface you're disinfecting, you choose the appropriate disinfectant. We also want to talk about surfaces or items that should be frequently disinfected. So that's going to include things like light switches, door handles, push handles on doors, the surrounding door panel where people often touch with their hands, common use equipment such as copiers or coffee makers, or shared laboratory equipment. These are things that need to be decontaminated and cleaned very regularly. Personal note, your electronics, your cell phones, your keyboards, your mouse for your computer, in your car, your steering wheel, your shift lever, the buttons on your radio, on your air conditioner. These are all things that we touch frequently. So making sure that we decontaminate those regularly. Our custodial staff here at Texas Tech will be wonderful in decontaminating those frequently touched surfaces daily. And we recommend that you decontaminate these items before your shift is over. You can also decontaminate them at the beginning of your shift, especially if you have shared spaces where you know other people are working or shared equipment that you're sharing. It's best practice for you to go ahead and disinfect that equipment prior to your use and then after your use is concluded as well, just to make sure that we are taking as many precautions as we can to keep everyone safe. Thank you for watching. Now let's talk about the requirements and procedures for returning to work on campus. Keep in mind this is during Phase 3 operations, and future procedures may change. The requirements. You must have approval from Human Resources and/or the Office of Research and Innovation. The approving office must have accurate contact information for you, including a valid email address and phone number. Personnel must complete the COVID-19 awareness training prior to their return. Personnel must be willing to complete a health assessment prior to reporting for work, should they be required to do so by the vice president of their division. There are two options available. The first one is you can visit an on-campus health assessment station. The second option will be to complete the CDC, or Center for Disease Control, self-checker and maintain the results of all of your surveys and provide them if requested. There will be two locations accessible to all employees as they return to the Texas Tech campus. The first one is operated by the Operations Division and will be the Flint Parking Garage Health Screening Station. This drive-through employee health screening will be available from 6:30 a.m. to 8:30 a.m. and 4:30 p.m. to 5:30 p.m. Monday through Thursday, and 6:30 a.m. to 8:30 a.m. on Friday. The second health screening station available to all employees will be located inside the administration building. It is being operated by the Office of Research and Innovation. The station will begin operation in early June and be available Monday through Friday from 7:30 a.m. to 8:30 a.m. Enter the station following the red arrows. Go to the blue star where you will have your temperature taken and answer health screening questions, and then exit the station following the green arrows. Additional health screening stations are being established across campus for laboratory researchers. Please contact your supervisor or the Office of Research and Innovation at research.innovation@ttu.edu for more information. Procedures in the event of a confirmed COVID-19 case. First, the sick individual should remove themselves from campus immediately and seek medical attention, including COVID-19 testing. Typically, infected persons are ordered to self-quarantine for 14 days. If at any time a faculty or staff member becomes diagnosed or ill with COVID-19, please contact Human Resources by emailing hr.talent.management@ttu.edu. Human Resources will then assist with the coordination of the faculty or staff member's leave and work with the Operations Division to ensure the workplace is properly disinfected. Persons in the vicinity of the infected individual will be notified of the positive COVID-19 case. This is why having your accurate contact information is so important. Persons who had direct contact with the infected individual must self-quarantine for 3 days and then receive COVID-19 testing. Should the diagnoses be negative, the individual may return to work at that time. Many on-campus resources utilized during the creation of this video training. The Operations Division, Environmental Health and Safety, Human Resources, and the Office of Research and Innovation have all provided guidance on how to safely return to campus. Phase 3 operations are also now published. Please keep in mind that as local, state, and national conditions change, the guidelines offered may also change. The resources gathered to create this training video with information about the coronavirus, its transmission, and its prevention were all gathered from credible resources, including the Center for Disease Control and World Health Organization, as well as the Governor's report on how to appropriately open Texas. Should you have questions as you return to campus, please consider reaching out to your direct supervisor first, followed by the vice president of your division. Additional questions may be pointed to Environmental Health and Safety at safety@ttu.edu. Should you have questions about obtaining personal protective equipment, please work with the Central Warehouse by emailing central.warehouse@ttu.edu. For questions about cleaning materials or their operations, please contact Custodial Services through operations@ttu.edu. Questions about obtaining additional personal protective equipment or materials can be routed through Procurement Services at techbuy.purchasing@ttu.edu. Questions related to human resources, including continuing to work from home and adjusted work schedules, please send to hr.talent.management@ttu.edu. Questions involving academic research on campus, please send to the Office of Research and Innovation at research.innovation@ttu.edu. Please stay safe.